Good morning. It's time to get in touch. In Touch is a public affairs show dedicated to improving the lives of Susquehanna Valley residents. I'm Freddi Hammer, News Director at Backyard Broadcasting. The new year offers a fresh start and a chance to set meaningful goals. Many people resolve to prioritize their health, making this the perfect time to highlight preventative measures that can help keep your health goals on track, like small, actionable steps, like staying current on vaccines, all key to avoiding preventable illnesses that could disrupt other health goals, like starting a new exercise routine. You got flu and COVID-19, which are common during the colder months, all leading to serious illness, and staying up to date on vaccines can significantly reduce the risk of serious illnesses for older adults, pregnant people, infants who are at higher risk. Today, we're thrilled to have Dr. Theresa Metanchuk. She's an osteopathic family medicine physician specializing in family medicine. Dr. Metanchuck is the chair of the Governance and Leadership Committee of the Pennsylvania Academy of Family Physicians. Thanks for joining us today, Dr. Metanchuk, on In Touch.
It's nice to meet you.
It's so great for you to take time to talk to us today about our health. It's definitely necessary.
And this time of year, it's even more important.
First of all, though, I want to know what an osteopathic family medicine physician is like. What's your specialty? Is that family medicine?
Family medicine. So an osteopath is somebody who went to a doctor of osteopathy school, so schools like PCOM or LECOM. Those are the two biggest schools in the state of Pennsylvania that are osteopathic. It's essentially the same as an MD, only we do a little bit more about recognizing what structure and function have to do with wellness. So looking at how our muscles, bodies, joints actually relate to wellness and how we can use them to also improve our health when we're not feeling well either.
So we're actually encouraged by the CDC to risk less and do more, maybe even consider some vaccines this year. So this is all sort of a situation where we've been hit, of course, with lots of viruses and things for the past couple of years, and we just want to get a grip on it. We want to be healthy, Dr. Metanchuk.
That's right, and I want everybody to be healthy, right? I live in this community, too. This is my state, and I want to be healthy. I want my friends and family to be healthy. I want everybody to have the healthiest start to the new year as we can. We're encouraged to risk less and do more.
Yes. What are some tips we have? Like, we want to know what people in Pennsylvania should actually be doing to avoid all these severe illnesses and staying healthy this year.
Yes. So everything is on the rise. We've got RSV, influenza, COVID. All of the respiratory viruses are rising in the state of Pennsylvania, and they're only going to continue to rise. The first things that we should be doing, or even thinking about doing, is getting vaccinated. Okay. And a lot of people think we should be vaccinating in the fall, and that is true. That's one of the best times to vaccinate, but it's never too late to vaccinate. We're in January, but we still have a good 6 to 8 weeks of cold and flu season left. So these viruses are still going to be going around up through March. And so getting vaccinated now is one of the best things that you can do to really keep yourself and those around you healthy.
When I was a teenager, I worked for a radio station where one of the news guys was a little older, and there was a vaccine question. And he was like, don't ever tell me not to take a vaccine because I had polio as a kid, and it saved my life. And so I think that's kind of the idea. Like, vaccines are here to help us.
That's right, they are. They may not completely protect you from ever getting it, but they're definitely going to make the severity of the illness much less and your course much shorter so that you're able to get through the virus much easier.
What are the latest vaccine recommendations? You said flu and COVID and RSV. I guess there's a vaccination for children for that.
Well, so RSV is a virus that hits everybody.
Oh.
It most significantly impacts kids and older adults. And we're actually seeing it run through nursing homes, and we're having RSV hospitalizations in our people that are older, 65, 75. Mm-hmm. They're getting hospitalized just as much with RSV as they are with influenza. Wow. And so the vaccine recommendations are for anybody who's over the age of 60 to be vaccinated, especially if you have risks with pulmonary or cardiac. So if you have heart or lung disease, RSV vaccine is definitely for you.
And what about COVID?
Right, the ones that we've been very familiar with for the last several years. Those vaccines are recommended for anybody who are 6 months and older. Kind of nice because they're both with the same guidelines. So if you're 6 months or older, get your flu and COVID vaccine. Help protect yourself, help try to limit the spread of disease, and protect those around you.
I guess that's really the answer when we're trying to support broader health throughout the year. Like, let's just sort of avoid a hard flu right here at the beginning.
Right, yes. And I think that's what we all want. We make those goals for ourselves this time of year to live healthier, to be well, A lot of times people are asking, what can I do for my weight, or I want to eat better this year, exercise better this year. And you ask those questions of your doctor to be well, to start the new year off healthy. We don't always ask, what vaccines am I missing, but we should be. And this time of year, getting those flu and COVID vaccines and RSV vaccine when you're eligible are really important to keep yourself healthy and keep those around you healthy. And we should be thinking of that in terms of broader scope. So looking at our communities, our families, our friends, the people that we interact with sometimes every day and maybe rarely, but they're going to be impacted by our choices as well.
I'm curious about the COVID-19. It's definitely something that's, we still are seeing some death from this, unfortunately. And we have a really small percentage, according to the data that I was sent here. 24.3% of adults in Pennsylvania received their COVID shots. That doesn't seem like the right amount.
Yeah, it's really not. It's not enough, right? Mm-hmm. Already in the last 3 months, we've got 350 COVID-19 deaths in the state of Pennsylvania. Mm. And you wonder how many of them could have been prevented with increased vaccination.
Sure.
So if we had a little bit better vaccine rate than 24.3%, could we have saved a couple lives? And I don't know. But I know that it is helpful and has definitely been shown to decrease the severity of illness and keep people out of the hospital when you get your COVID-19 vaccine. And really looking at our high-risk populations, right? Mm-hmm. So when we have people who are older, living in nursing homes, if you have heart or lung problems, maybe you're on medications where your immune system isn't as strong, those with things like autoimmune disease or cancers, these viruses, specifically COVID, they're going to hit you harder, and you have higher risk to be put in the hospital because of these diseases. And so we want to make sure that we're doing as much as we can to try to keep everybody healthy. All Pennsylvanians deserve that chance. But yeah, that's not the best number, 24.3, and I'd love to see it much higher than that.
About the flu vaccine, we get it every year, but it does change every year. Is that right? It seems as if researchers have to do their best educated guess of what's coming. And is that easy to see as a researcher, or is that always a question?
It's always a question, and it's not easy at all. And we range anywhere from 40 to 60% as to how good we are at guessing, which to me is, you average that out at 50%. That's, I think, pretty good.
Yeah, I do too.
And anything is better than nothing. So even if we're seeing a 40% benefit from our flu vaccine, it's better than not having anything.
Absolutely.
And think of everything that can be protected and saved, the hospitalizations that you can decrease if we have something that's 40% protective.
One hand, you're talking about a vaccine, which I may have questions about, but the illness itself can be so much worse, and we want to make sure that we have those healthy protections, I'm sure.
And I think that's what really people should be looking at, right? So what's your risk of the disease and what's your risk of the vaccine? Because everything we do in life has a risk-benefit ratio that we're looking at. Mm-hmm. And when we're looking at the vaccines, the risks really aren't that big. We've got some soreness around the injection site. It might make you feel a little tired or weak, maybe a low-grade fever for a couple of days, and then you're feeling pretty good again. Mm-hmm. But when you catch COVID or you catch influenza, you're looking at several days of a high fever, body aches, breathing difficulties, pneumonia possibilities, hospitalization or ICU admissions, and the risks are much higher.
I'm curious about the contents of the vaccines, and where can we go to find what's in it, and how's it going to affect people, and what are those percentages of how it helps and how it doesn't help? Do you have information about that?
Yeah, so the best resources for vaccines are two websites I usually tell people, vaccines.gov, great resource there. And then you have the cdc.gov/risk less, do more. And you can find a lot of information through these two websites to really help make an educated decision on what's best for you.
Just a little bit of background about you. You went to Temple. You were definitely a Pennsylvania girl, like you said, and you're actually a board member and president of the Pennsylvania Academy of Family Physicians. So you have our best interests at heart, I think.
Every day I have the best interests of our fellow Pennsylvanians at heart. Absolutely. This is my community as much as it is yours.
Well, thank you. It's Dr. Theresa Metanchuk, and she is the osteopathic family medicine physician, president of the Pennsylvania Academy of Family Physicians, taking time out of her busy day today to talk to us about our flu vaccines, which are definitely necessary. Thrilled to have you here to tell us all about it.
Absolutely, absolutely. And I hope everybody listens to this advice and really goes out and gets those flu vaccines. It's not too late. You've got plenty of time to keep yourself protected.
I'll go out and get mine right away. Thank you so much, Doctor. Have a great day, and thanks for joining us on In Touch.
Thank you. You too.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us regarding questions, comments, or topic ideas, call weekdays between 8 and 5, 570-323-8200. You can also write to us at 1685 4 Mile Drive, Williamsport, PA 17701. Attention Freddi Hammer. Or email me at fhammer@backyardbroadcasting.com. For archived programs of our In Touch series, you can download and subscribe to our new Backyard Podcasting feature through a link on any Backyard Broadcasting website or obtained where podcasts are available. You can also subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch, a production of Backyard Broadcasting.